It's Lorie Brown from empowerednurses.org, and I'm here today with my special guest, Rosemarie Yetman. And Rosemarie is a registered nurse in the emergency rooms in New York City. And I'm so excited to have her here as my guest. In fact, I was thinking last night how interesting it would be to talk to one of the nurses on the front lines and interview them, and then Rosemarie showed up. So it's perfect. So welcome, Rosemarie.
Thank you. Thank you for having me here.
So why don't you tell everybody about yourself?
Awesome. Okay. So, my name is Rosemarie Yetman, and I'm a registered nurse. I work in New York City, and I work in the emergency department. I love what I do, and times like this, it really calls out your vocation as a nurse. So I'm happy to be here and talk about what's going on and that's impacting us all.
So I'd like to say, first of all, thank you. Thank you, thank you, thank you for being there, being the first responder, being in the front lines and helping everybody, because without you, and we would not survive. And when you think about things in terms of how we are doing this quarantine or stay at home, shelter in place. Okay, that's the key word. We're doing the shelter in place to help our healthcare system so it doesn't become overwhelmed, and you can take care of the people the way that you're supposed to take care of them and need to take care of them without being overwhelmed. And I know they're looking for offsite places and different things to help people, to house people and things like that who need care. So
Yes.
tell me what you're seeing. What's your
Yes.
experience?
Yeah. So, I work in the heart of New York City, and, it's definitely out there where New York City is receiving so many cases. We have patients that are coming in every day that are exposed to COVID-19, those with severe respiratory issues, even those that are having belly pain and things like that, where they are being hospitalized, and we have to think on the whim on how to change up operations to accommodate a growing number of cases. And I moments like this, where we are in crisis mode, we come together more than ever. And I thank my team. I thank my nurses on the front. I thank my doctors on the front. I think even my nurse manager, director, administration, operations. Everybody is really like just coming in and making the best out of what we have. And that in itself, like, just make me so proud to be a nurse. It really truly does, to be on the front. And also, when you have crisis moments like this, you don't really, well, for me at least, you don't really separate yourself as, okay, I'm a healthcare worker, and this is what I do. But I also feel part of the community, right? And I feel that I haven't in a long time felt like the community and healthcare are on the same plan. That
Mhm.
that right there, like, I feel that we we are so cohesive in how we are trying our best to deal with this pandemic, that I don't first physically feel like I have to communicate with the people that I see traveling, right, on the train with me when I come home from work. I feel we actually lock eyes, and you, like, that level of, like, just camaraderie and in it together, and we're both going to play our part, really speaks through just by eye contact. It's incredible. It's
Wow.
incredible.
So you've seen a lot of change for the better since this has happened.
I see a lot of change for the better, and I see also areas where, we're taking it hour by hour, right? We're making changes as necessary. Um, and I just see people not only coming together in the general New York City area, in combating COVID-19, but also I see, assistance from um, big organizations like, the ANA, who are like, on the front lines for safe protective equipment, right? For those who are caring for people that are, COVID positive. Um, or and protecting them, right, from getting COVID, right? Like, I see that high level of engagement there, and I never, I haven't felt like, I haven't always felt that, you know, um, nursing was always supported in that sense, in like I haven't always felt that way, but I feel that, even everyday civilians are like, we're like, they're just bigging us up, and like they're just like, making us also just re-energize our reason for like, oh yes, you know what, this is what we're here to do, we love this,
Right. We're
uh,
built for this. We're built for crisis. That's what
exactly,
nurses are. Yeah,
exactly,
because you don't
exactly.
know when somebody's going to code, or
Hmm.
we never envisioned this situation, but wow.
Yeah, yeah. So I'm just happy in the response of like support, just making it out there, like, yes, we, you know what, we need equipment. That is a struggle, and I think it's a struggle everywhere, that
Mm,
it's, equipment is on low supply, but I think people are putting things in production where we're getting more and more equipment, to in order to take care of the patients. I think hospitals in generally are doing a great job in routing patients, so we have the space to take care of more COVID patients
mhm,
that require isolation. And I can tell, I see I see the bags on people's eyes that are like, that are just like out countless hours that they're in this, and they're trying to develop the best plan of action to keep everybody safe.
mhm.
I that level, I have so much more appreciation for the ecosystem, right, like of
Yeah.
people that are working together here. So
And what scares me is these patients are all alone because the visitors can't come in, right?
yeah, visitation is limited. Right now, I think to one person. um and it's sad, and it's scary, and scary for everyone for sure. And it is, a to me, is a necessary sacrifice that we have to, enforce for their safety as well.
Yeah.
But yeah, it's not easy. And we have brick and mortar, locations where we have to isolate and decrease flow. We have to decrease the chances of spreading the virus. And that's, yeah, it's scary. It's definitely scary, and it's scary for those who are at home too, on self quarantining, and that are alone, that are elderly, and they've always had to maybe rely on family, or services to come and assist them too. um it's definitely a scary thing. Like, I had a patient the other day, and she was so scared. She was crying, and like, she also works in healthcare, and I think she works in a like assisted living type of facility, and the look on her eyes said it all. Like,
Mhm.
it said, like, I never thought it would be like this could happen to me,
Yeah.
you know. uh I Yeah, those moments I think it boils down to like humanity. Like, those are the moments that where, I feel like I offer the most nursing support, just helping them, embracing them in those moments of despair. Um, yeah, yeah, it's definitely scary. And she was alone too.
Do you have enough staff to do your job?
You know, people are coming in, they're volunteering for like, um, they're putting themselves available to come in to work to help, um, with the patient loads. I think it's been a struggle, especially when patients were coming in with concern for COVID, because there's also different, levels of sick or worried well.
Yeah.
And then you had the general population coming in as well with their medical concerns
Yeah.
aside from COVID,
I don't
right?
know if I'd want to go into the hospital now.
Yeah, but like the census was super high, and we was trying to mitigate that on how do we, manage patient care, how we meet how does, supply meet that demand. Um, but now like we have different triaging and sorting, for those that are meet certain criteria.
Yeah.
So those that are in the ED is, you know, truly sick. Um, it helps us manage our patient load more tightly. To be honest with you, yeah. Like I did a shift today, and I felt that oh, we're getting a handle on this. I was hopeful. I felt hopeful actually. I was like, mm. In the beginning, I was like, oh, we're in it. We're bracing. This is, we're soldiers here,
Yeah.
But yeah, I felt that okay, we're figuring out a system that actually is working now, and we are definitely getting prepared for the peak. Um, so I have high hopes that the current operation layout that we have in place is definitely going to help with management of those cases that come in. I do.
Yeah. So are you scared for yourself and your family?
Yeah, because we're humans at the end of the day. Yeah, I am a nurse. I'm also a mom. I'm also a daughter,
Mm.
um, and a sister. And a wife, right? Like
Mhm.
have to come home and make sure that I am not um, being a carrier to expose my loved ones. It is scary. It is definitely scary. That's why we gotta, there's memes all over the place about people's spouses or like waiting for them at the door with lethal cans to spray them head to toe, like you just this like throw their clothes in like garbage incinerator or whatever. But yeah, but it's definitely a high vigilance, at least in my household, that when I come in, I my work clothes go into a separate container. I'm hand sanitizing, I'm washing very diligently at 20 seconds or more actually. I never counted I've never counted. Happy birthday never worked for me, but now I'm like, you know what? I'm following a method that equals out to 20 seconds, and I'm also counting at times, like especially when I'm busiest. I'm literally counting to 20 at least. And I think I haven't caught a fever yet. I haven't displayed symptoms yet. I've been on the front line since. Um, and I think also as nurses too, and healthcare providers in general, I think we have strong immunity, like
Yeah.
because
Yeah. Because we are exposed to a lot. Yeah.
yeah, we're exposed to this a lot, we, yeah. So thank God, like, I haven't heard of too many people that in my circle of colleagues that has came down with serious symptoms yet.
Well, good, good. I hear of some nurses and doctors separating from their families because they don't want to get them sick.
I've heard of cases like that too. But I haven't but I heard of people like deconning themselves more popularly, like more commonly, Like they're like kind of like in their garage, they're
Yeah.
they're staying in the lower level, and they're not like, um kissing their kids, right? They're not hugging their spouses, and um they're virtually isolating themselves, you know from their families, which is tough. It's tough mentally too,
It
you
is.
know.
And how long can we keep this up?
It's like wartime. It's like I put myself in like wartime mentality, and like I have no choice. I have a duty. That's that's how I, you know, um see it and proceed with it. But I do feel like I never had a stronger team ever. Like I feel like everyone, I've never seen the level of cohesiveness in nursing and medicine. But like collaborating from the same vision scope, right? Like
Yeah.
I have not seen that. I've seen medicine seeing issues from their point of view this way, nursing seeing issues from their point of view this way. Maybe some interdisciplinary collaboration as necessary, right? But when it comes down to like this epidemic, I call it epidemic. I tell you that before, but like this, I think that we are sharing the same view.
Yeah,
Like we
because
are,
you have a common vision of helping everybody. Yeah.
yes,
Um,
yes,
well, I'm grateful that nursing and medicine are coming together and collaborating. I'm grateful that your nursing staff has come together as a team and working very efficiently together, because that wasn't happening before. And I'm grateful that nursing is being recognized. I said this in a quote. I said, well, it got quoted after I said it. It was that who knew that when WHO named this 2020 the year of the nurse.
oh yeah, right. I saw that,
Yeah.
right. We wasn't talking about this.
So that, yeah, we were not expecting this, but like in any crisis, hopefully some good will come out of it. And for those of you watching who know a nurse, please have groceries delivered to their house, have dinner delivered to their house, do something to help them, thank them, recognize them. They are carrying the burden in our society right now because everything else is pretty much closed and we're sheltering in place. So any nurses that you know, please give them
Yeah,
your support. Tell them how much you care for them. We are grateful to have them to take care of, you know, to take care of the people that need us in our society.
yeah.
Um,
That what you said right there raises a really important point that I would like to, add to that. I see that those that are, on the front lines, and they're tackling COVID cases, and they're giving up their time too, right, to be taking care of patients, and those concerned with the illness and the virus. When they are going home or they're looking for supplies, they're like the shelves are empty, right? There are nothing that they can gain access to in terms of food supplies for their home. And I just want to also put that message out there that there are people that um you have to just consider moderation in terms of like toilet paper and things like that, like, because I've definitely heard I heard that echoed a lot with my own people I know personally that's been, just doing, blocks of shifts, and then they will go to, find supplies for their own self, and they have no, food or
yeah,
anything for their own stuff at home. And then people stay home, like just everyone needs to do their part in preventing the spread. um just stay home, but if you feel sick, you feel sick, you having symptoms that are concerning, yes, definitely come to us. We'll treat you, we'll help you, but don't go. This is not the time to go for strolls, and this is not the time to like see what's open to hang out at and stuff like that. This is the time to really everyone do their part in community health, public health, population health. Okay.
Thank you, Rosemarie. I truly appreciate it. And as you hear directly from a nurse on the front lines, they don't have toilet paper. They don't have groceries. They come home late at night. They're tired. The stores aren't open late anymore. Please help them. They're helping us. They're helping our loved ones. So please, they're helping our community. Please, let's do our part in return to thank them. So thank you, Rosemarie. Thanks,
Thank you.
everybody. Bye.
Bye.